Hello, Latinos in clinical research. Welcome back to a very special series that we're doing, career pathways in clinical research. And we've got Ashley Margot on, and we're going to talk about her career pathway. And the reason why we're doing this is we want to share similarities, maybe for the audience members out there, as to what is possible for your career pathway. Maybe you're somewhere on this journey. Maybe you're at the beginning. Maybe you're at the middle. Maybe you're even near the end. So we plan on interviewing other members from Latinos in clinical research as well to discuss the career pathway. So welcome, Ashley. How's it going?
Hey, Dan, Judy. Good, good. Busy, but good.
Did you know about clinical research during college?
No, I did not know about clinical research during college at all. And actually, for most people, yes, it does start definitely right after college. But I definitely must say that I started working since I was 19 in the clinical industry. So that clearly, had a very positive impact coming out of college, because most people do come out and have difficulty, getting a job due to career experience and not having any. So if I could give any, advice to anybody, if you're in college, if you're new and Latinos in clinical research is new to you, highly suggest trying to do an internship or something that gets your feet wet, whether it's free or paid or not. But yeah, so I was in the clinical healthcare industry for about 10 years. I came out and I was from a rural area, so I really wanted some opportunities. And what I ended up doing is I applied for a bunch of jobs, public health and clinical, throughout the state of Texas, and I got a job as a clinical data specialist in Austin, Texas, representing UT Southwestern Medical Center. Initially was not necessarily what I wanted at all, to be quite honest. I wanted something straight off the bat with a CRO or sponsor. More specifically, I was looking at sponsor. However, obviously I didn't have the exact background that they wanted. So I thought that going with UT Southwestern Medical Center would be really great, because they have a good background. They're known for research, and they're known for their different Nobel laureates that they have. And so I felt like, as a name wise, it'd be very good backing. So I was there for about 2 years when I, started to finally, understand research and do some, little bit more digging into it. And then I started to get involved with organizations. A big plus, it's a huge must that people must do, I think, for networking purposes, but also, that it's just, it looks good, right? And so did that, got some certs on the side by myself, and started to apply like crazy. And fortunately, here I am today with the major global CRO as a remote site monitor. Yeah, I mean, took some time, right? But I think that if you know how to use your background and use your skill set and kind of sell yourself in that aspect and how it works with the clinical research industry, you can easily get a position anywhere.
And so I guess to ask you, what do you see, or like, what do you want to do in the next few years? Like, what do you see yourself doing? What's on your goals, what your list of goals that you want to achieve?
So obviously I want Latinos in clinical research to have a very, very broad, expanded viewpoint with different areas within not just the clinical research industry, but I'd like news networks to know about us. I'd like it to be on a very massive scale. Part of where my organization comes in hand, right? I'd like my company to my side company to be helping tons of people, but also college students, and more preferably as far down as high school students. And so that's kind of a plan I'm actually working on the side little by little. But with the industry itself, I want to be a consultant, and I would like very much to be in the AI biotech sector. That's really like my ultimate goal right now. What I'm doing to mold myself is I'm very fortunate. My CRO provides academy trainings and things like that. So I am doing all that I can to take these side trainings in different aspects with the biotech sector, as well as specifics in gene therapy and all those kinds of things, CNS, because again, it's like Dan said, and like we all continue to say, generalists are going to pretty much I think run the world, and I feel like I already have a very good foundation for that. I just need to now diversify my specialty knowledge, right? And so that's kind of my focus in the meantime. 2, maybe 3 years from now, go that route. But during this time, I'm going to just be building brick by brick. I'm going to be building my wall, ultimately creating this empire or foundation, however you want to put it. But that's how I do it, you know. That's what I'm focused on right now.
And you missed a really good, I'm going to do shameless plug, clinical research circle. If you talking about generalist with biotech, Greg Johnson.
Oh yes, I saw it.
I'll send you the replay. But Ashley, I'm glad people have the opportunity to follow your career specifically, and I'm glad we featured you first, because in many ways, as you're talking, I feel like you're the most relatable member to the audience, because myself, Judy, Monica, I mean, we're site owners. It's kind of like a super niche. And I would say 80% of our audience are not interested necessarily in site ownership. They might be interested in what we have to say, but they can't relate like they can to you.
Yeah.
You're somebody that came out public health, then you're working for a CRO, sponsor, you know, you're a lot more relatable. Not to mention you're the most recent experience from our members. So people get to like follow your career throughout all our Zooms and all that. So I'm excited for this, and Ashley definitely knows what she's doing online and with LinkedIn, and just go check out her LinkedIn if you want to network with her. The link to Ashley's LinkedIn is underneath the video. So thank you guys for watching and listening. We really appreciate it. Thank you, Ashley, the people's champ, the relatable one. That'll be your new nickname.
The relatable one.
The relatable one. I don't know. Maybe we'll find a better one. I don't know if that sounds good.
Okay.
But you get the gist. So thank you guys. Thank you, Ashley. I appreciate it. And thank you everybody for watching. Catch y'all later. Bye-bye.
Thank you.